Because he gave up his atheism, his beliefs changed. He became very interested in the whole next realm and started sending me videos and things that would be useful. So that was a very healing thing for him. Sometimes people who are dying have dreams. And those can be dream equivalents of a near-death experience. I had one patient who told me, I had the most amazing dream last night. I popped out of my body and went down a tunnel and saw a being of light. Now, he didn't have a near-death experience in physical measurement or observation, but he had a dream equivalent. And he said, I no longer feel afraid of dying. And I've had a few patients like that, and they died with total confidence. I also wanted to talk about the importance of, another story I want to tell you about is a young 28-year-old woman who had a transplant and then relapsed. And she wanted to know what it was like to die. So the staff said, well, we'll call the palliative care team to help you, because she knew she only had 2 or 3 weeks left. And so the palliative care team came and said, well, your breathing's going to change, you may feel colder. And she was horrified by the end of it. They told her what it would be like physically. And I happened to come by an hour later, and I said, well, and I heard about this, and I said, did they tell you what it felt like on the inside? And she said, no, other than these features. And so I said, well, I can tell you about near-death experiences and what people have, what they really experience on the inside. And it totally transformed the whole scene. So her thoughts of dying went from being very macabre and being buried 6 feet under and nothing to face but bleakness to, oh, there's going to be a celebration on the other side, and it could be interesting. And I promoted the feeling, as Dr. Fenwick talked about yesterday, of being curious. And so her husband, I suggested she watch that film, Life After Life, by Peter Shockey, which really gives a good experiential feel of what it could be like. And she and her husband watched it, and she said, oh, this is kind of interesting. And we started talking about her uncle who was on the other side and how he was such a jokester and how they could have fun together. And she started looking forward to the reunion they would have. She did die several weeks later, but that whole next 2 weeks, she lived with a feeling of, okay, I'm going to a party, I'm going on a trip. And she was really able to come to some sense of peacefulness and acceptance of what was happening, with a greater sense of hope than she had been when she was left with just the physical word about what her body was going through. So it's so important that we give hope to people who are dying, and this is one way we can do it. As mentioned yesterday, it's common for people who are dying to see visions or dreams of loved ones arriving to welcome and escort them to the other side. Now, Dr. Christopher Kerr, in his TED Talk, suggests that we say, have you had dreams or visions of loved ones who have passed over coming to see you? And I've done this frequently with my patients, and including my mother when she was dying. The day she was dying, I said, do you see anybody here? She could no longer talk at this point, but she was still with it to some degree. And I said, do you see your parents? No. Do you see my dad? Yes. So just to make sure that there wasn't any mistake here, I said, do you see your parents? I asked her again. No. But you see Dad? And she had this big grin on her face, and a few hours later she passed away very peacefully. I was called to, or I was told that an acquaintance of an acquaintance was in a hospice, and I thought, well, I'd go see her, but I thought she had a few weeks to live. Well, I got there that evening, and we had quite an animated conversation, but I asked her if anybody had visited her, and she'd been seeing her deceased brother in her dreams. And I said, well, he's waiting to celebrate you with you, and what a celebration it's going to be. I told her about near-death experiences, and I quoted the lyrics from Going Home. the spiritual, about Mama's waiting there and Papa is there too. And I showed the husband how to do a little bit of therapeutic touch to make her feel relaxed. And I said, well, I'm not sure when you're going to go, and I'm not sure when I'm going to go, but if you get there before I do, then I hope you'll welcome me. And if by some chance I get there before you do, I will certainly welcome you. But otherwise, I'll see you next Saturday. I didn't want to not say goodbye, but I didn't want to force the issue and make it dramatic. So she said, oh, that would be great if you can come back on Saturday, and thanks. And she was very, very bright and animated, so I thought, well, I'll probably have a couple more visits with her. So I left, saw her husband in the parking lot 10 minutes later, and he said, oh, she's gone to sleep, so I'm coming back in the morning. Well, she died in her sleep 3 hours later. She never woke up. So I think that telling her about the celebration and reassuring her gave her such hope that she was able to peacefully let go. So that was quite the story. I was quite surprised, actually, that she died several hours later. We've talked a little bit about the shared death experiences, so I'm going to move on. We can also use near-death experiences therapeutically in other situations. And I talked the story of people who are grieving their own anticipatory losses. Because when people die, they're saying goodbye to everything. We may be saying goodbye to the dying person, but they're saying goodbye to everything in life, of their home situation. And this can be trigger other grief. And so focusing on hope and celebration and what's next can be a helpful thing, I think. Also, it can help with spiritual dilemmas. Jackie was the born-again Christian who I mentioned yesterday was afraid she'd never see her husband again, and her pastor said that you probably won't, and she went to her GP. So how I used the near-death experience in that point was, I said many Christians have had near-death experiences, and I suggested that she consider thinking outside the box and that God could come up with a solution much greater than we could think of. And this satisfied her and gave her greater peace of mind about her husband's future and that she'd see him again. But the doorway, or the technique to access that was by talking about near-death experiences and that Christians had had them. So she was able to accept that, and then we could move beyond the narrow thinking. Sometimes I've talked about near-death experiences to relatives of people who've died. My patient Paul was dying of throat cancer, and as he became more ill, we talked about his spiritual beliefs, and he said, well, maybe I'll go somewhere after dying. We talked about near-death experiences to give him some greater focus, some ideas, and increased hope. Neither of us knew, but it would be our last appointment. After his death, 2 weeks later, I met with his sister, in which she felt reassured by learning that he had said, well, maybe he'd go somewhere after dying. And she derived some comfort herself from watching the video with me about near-death experiences. And I told her, well, I watched that video with Paul also before he passed away. And that gave her a connection because she was connected to me with this video, but because he'd seen it just before he died, she felt, okay, well, I'm experiencing some of the thoughts that he had before he died. So it was kind of a link, a nice linkage. And she felt kind of calm and reassured in her grief. Now, the next one is probably one of the most important areas that we need to be using near-death experience wisdom with suicidal patients. And suicidal patients do not appear just in emergency rooms or to psychiatrists. They can appear in any setting. They can appear in an outpatient setting, such as the young mother I saw 3 weeks ago with chronic life-threatening blood condition. She was battle-weary. She wasn't accomplishing much, and her self-esteem had dropped. She'd had no previous faith, no life purpose. Her marriage was strained. They were all exhausted, and she was thinking of killing herself, and she had 2 little children, 5 and 7. Just earlier, a few weeks earlier, I had a young father in his early 30s saying, if my leukemia comes back, I'm going to kill myself. He had a 6-year-old daughter who adored him. Now, people can also have suicidal ideation who may be in your circle of friends or family. And so it's important that that this message is understood by everybody. It's not just for healthcare professionals. You've got to trust your intuition. And if you really think somebody is, then you've got to act on it. And be encouraging. But if you're unsure, send the person to emergency or go with them to emergency. But what I say to people in this situation is, it may feel as if it's hopeless, even though the reality is not hopeless. It may feel as if it's hopeless, even though the reality is not hopeless. I want everyone to repeat that with me. I'm going to say one more time. It may feel as if it's hopeless, even though the reality is not hopeless. Because if you say, the situation's not that bad, yes it is. No, it's not that bad. Okay, you're right. But inside, they're saying, yes, it is. And then they just argue, people will argue with you. And they'll just say, you just don't understand how bad it is. So if you feel it feels as if, you're no longer fighting with them, you're agreeing with the person. It does feel that bad. It feels as if it's that bad, even though the reality is that it isn't. So you slip that in, and it's a subliminal way of giving hope to people. And I also say, harming oneself could be a disaster of permanent effects and tragic effects for what is very likely a very transient situation or transient mood. Then, I often tell patients about near-death experiences. And I'll say, this is what we know from people who have tried to harm themselves. And that there is a spiritual realm. We are known very personally and loved by a spiritual force or higher power or God who is aware of our circumstances and life events. Our lives do matter and have individual purpose and meaning. Loving others is most important. And so for that father, I said, your child needs to know she's loved. And your child needs you. She needs you. You're her only father. And even though we don't know what the future holds, but you will always be her father. And if you exit early, it can send a lifelong message that she was not worth living for. Even that you gave up three weeks earlier than you needed to. And she might interpret it that she was not valued enough. So parents don't often think that. I also said that to the other woman. And I said, look, what we know from near-death experiences is that you do matter. And I also then tell the story of, I'll just leave it on this slide for a minute. I tell the story of Sandy, who's in that video. And she was a nurse who shot herself in the chest. But survived. She had a cardiac arrest, and police were called. But she had a near-death experience. She watched the policemen come. She watched the ambulance attendants come. She wanted to argue with them that they were getting some facts wrong, and that she watched her body being taken out on a stretcher to the ambulance, and she followed the ambulance to the hospital. And she said she felt very loved. And she said to this being of light, where were you? And the being of light said, well, I've been here all along, you just couldn't see me. But she said she felt so loved, and she didn't want to come back to her body. And she was told, you can stay in the spiritual realm, or you can go back. But if you stay here on the spiritual side, you will have to go through every amount of pain that you've gone through in the earthly life, and then go from there forward. She said, wow. She said, I thought back about my life, and there'd been some good moments, but there'd been a lot of pain. and I didn't want to have to go through that again. So she said, I learned that there's no point in cutting your exit short, because it's like dropping out of a grade 10 partway through, and then you have to go back and start at the beginning of grade 10. She didn't say that, that was my analogy, but you have to go back to the beginning and go further on. And she said, you're not saving yourself any problems by doing that. So I have used that story many times with people who are suicidal, and I say, this is what I've learned from people who've had these accounts, and this is the story of Sandy, and this is what she said. So I don't know if it's a good idea. I don't think that you're going to help yourself by exiting early. And so what I've written here, the possible consequences to suicide of having to redo life's pain or challenge. And I said, and what if you get on the other side and you say, oh no, I've made a mistake, but it's too late now. So that's another comment I make. So I used that story of Sandy with Lara. And Lara had fluctuating suicidal ideation, but I told her about Sandy, and the comments had such an impact that she went home and thought about it, and came back a week later, and I said, have you had any more suicidal thoughts? And she said, oh, I didn't dare think about acting on those suicidal thoughts after what you told me. She said, I don't want to go through all of this trouble again. So that was that. And she has not been suicidal over the number of years since that occurred. And I'm glad to say. The fellow that I told you about, the father, he did not commit suicide. He hung in there. He spent the time enjoying every moment he could with his daughter, and he died just a few weeks ago. But his daughter saw him the day before she died, and he was her hero. So I think we have a role about teaching about near-death experiences to patients in the emergency, in inpatient and outpatient settings, and in suicide prevention clinics. I want to talk about my group that I had with women who were dying of metastatic breast cancer. They came every week for 90 minutes from the time they registered in the group until they died. It was a study to see if they would live longer if they were in a support group. And they learned from each other. It was an amazing experience. I led that group every week for 6 years. The first one who died had wanted me to give the eulogy at her service. And so that set the pace. From then on, all of the patients, all the women in the group and myself would go to the service and sit together, and then the next group we'd talk about it. We had an angel mascot that was given to the group. It sat in the group every time, and it sat at the front of each celebration of life. And it was a reminder of the spirit of the women and angelic presence. In that group, there was a woman who said, she had 3 small children, and she said, every day I can live longer is one more day my children have a mother. And I never forgot that, because at the same time there was a woman lobbying for medical assistance in dying, who also had a young son at that time. And I thought, what a contrast. If I were a child of either of those mothers, which home would I rather be in? A home where the mother was fighting to leave earlier out of feelings of wanting to be in control of her life, and I understand that, appreciate that the mother was feeling a sense of lack of control and wanted to determine when she died. But would I want to be the child of a mother who was fighting to leave me earlier, or the child of the mother that says, every day I can live longer is one more day my children have a mother? I've used that quote with many of my suicidal patients, including those 2 leukemia patients I just told you about, the mother and also the ardent, and they said, no, I'm not going to commit suicide. And I've emphasized that even with a terminal illness, a parent can demonstrate being a hero to children as his or her legacy. Our actions matter. And I also say every additional day lived might be just enough for a new drug or a cure. And I sometimes tell the story of my father, who was told that he went to the doctor and found he had a very high white count and was told he had 3 weeks to live, and which was a bit of a shock. They phoned me and said, "Are you sitting down?" But in fact, he found out the next day that the diagnosis was a different kind of leukemia, and in fact there was a new drug that had just come out within the past 6 months, and this drug revolutionized the treatment of that form of leukemia. And my father died 11 years later of a completely different cause. So every day that you can live longer or keep going might be just enough time to change everything. And sometimes I do use antidepressants in low doses because I feel that when people are that stressed, and including in palliative care, that it can just reset the biochemical state that their body is in and can increase resilience. And that's how I put it. It will help you feel that you can cope a little bit better. But that's not for everybody. But sometimes people do have symptoms of depression in that context, as well as dealing with all of the other aspects of dying. You might say, of course, people might be depressed in palliative care, but some people have a clinical depression in addition to everything else they're dealing with. And not everybody who's in palliative care has a depression, for sure. People can be terminally ill, they can be tired, or weary, or excited about the next realm, or accepting, but not necessarily depressed. Sometimes we can give hope from a spiritual occurrence. I was at a conference a couple of years ago, and a man with psychic abilities, medium, said, "Someone you know has recently had tuberculosis, and he's withholding information from you. It's important you discuss this with him." I went back the next day to my city because I knew there was only one person I'd known who'd had tuberculosis recently, and it was a leukemia patient who had reactivated TB because he was immune suppressed. So I told him that I'd been approached by this man, and my intuition told me to ask him, "What is it you're withholding? Are you suicidal?" I'd previously asked him in appointments, but he always stated he wasn't. He broke down and told me of his desperation the previous week, and he felt that his teenage daughter was rejecting him, and that was the last straw. And he felt his life had no meaning. He's Chinese, and saving face was important to him. But he couldn't believe that I was onto this. And he said, "How did you know?" And I said, "Well, this is what I was told, that to ask you, that there's something being withheld." And I said, "I'm not accusing you of not being honest with me, and I'm not incompetent. It's just that we needed to explore some issues further." And when he thought about it, he said, "I can't believe that God loves me so much that he would send somebody from Florida to my therapist from Vancouver, and that we would meet in Scottsdale, Arizona, and he would give you a message about what I was up to last week." He said, "I can't believe that God knew everything I was thinking last week." And so this was incredible to him, that God loved him that much, and that God knew everything that was going through his mind. So he felt loved. He felt understood, and he said, "Wow, I guess my life must have some purpose if God cares about me that much." And so, as a colleague said, well, a life was saved. If I hadn't had that experience, who knows? I mean, he'd been denying the suicidal ideation to me. Now, how else can we use near-death experiences? We can use it for spiritual development. Sometimes we can use it when a person is not specifically religious. And this is one way that you can share spiritual growth without proselytizing. And this is the big concern in hospitals. And certainly in North America, we're not allowed to proselytize or to talk much about religion. But this is a way that we can talk about it. These are experiences that people have and that you should know about. And so we can underscore the possibility of a greater purpose in life and a greater context for understanding one's suffering. Maybe there's some potential meaning beyond what we know, what you're going through right now.